Loftus heart dissection. Here we have the lamb's heart. We have used a scalpel in order to split the heart either side so that we can discover what's inside. If we look on the first side, this is the right side. You can see because it is concave on this side and arched this side, which shows that it is the front. If we look inside, you can see where the blood enters the heart. Through this here, this is called the vena cava, and it comes in and enters the atrium, which are these flaps here. Both sides, they're seen as flaps, whereas in a human they're a bit bigger, but because it's a lamb, they're a lot smaller, but when they're filled with blood, they would look more like atriums. It then comes through the atrium, past the tricuspid valve, which you can see here, attached with tendons, which are also known as heartstrings, and into the right ventricle. The right ventricle is quite thin compared to the left side, which is a lot thicker, because it only has to pump the blood up to the lungs rather than all the way around the body. When it is pumped, it goes through the pulmonary artery, which comes out here. The pipe's gone, but it would come out there, and then to the lungs because it is deoxygenated, so it goes to the lungs to collect more oxygen. Once been to the lungs, it comes back through the here, which is the pulmonary vein, into the heart, again through the atrium on the left side here, through past the bicuspid valve this time, which is here, and into the thicker left ventricle. The valves on either side prevent the backflow of blood and keep the blood where it should be. Because the wall is a lot thicker this side, it has more muscle power, so will give a bigger force of blood flow up through the aorta, which is here, which we have dissected in half. So this is another tube, and it will be pumped all the way around the body, the bigger muscle giving it a bigger force than the right side, because the right side, as we said, just has to go to the heart, to the lungs. Here on the front you can see some of the coronary arteries. These supply the heart muscle with blood and glucose in order for it to do its function. Here all the tendons hold it all together, and you've got the valves. And finally you've got the aorta, which is a much thicker tube than the vena cava, because it has to withstand the pressure that the left ventricle gives it to push it around the body. Again, on the aorta where we've dissected, down here will be the semilunar valve, which you may not be able to see on the camera, but that also prevents the backflow of blood, and you have a bit where the tube splits off, where it will go to other areas of the body. Dissection complete.